Welcome. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. I want to thank you for joining us for the March 11th edition of the Cross Industry Update with Boulder County Public Health. Again, this is your weekly opportunity to get updates from public health and also to ask your questions. Please put those questions in the Q&A feature. I use the chat function to push information out to you. If it's the only place that you can put questions, then that's fine. I do not unmute people. It's really hard with the number of people that we bring in to be able to unmute you. So I will ask the questions on your behalf. If you've emailed me questions, I'll also ask those questions to Lane today, and he'll answer as many as he can in the time we have permitted. At this time, I'll hand it over to Lane Drager with Boulder County Public Health.
Thank you, Corinne. Thank you all for joining. If you haven't joined us before, give you a quick rundown of what we will cover, but I imagine many of you have. We'll give you kind of the update on where we're at with all of our data and disease tracking, what's been going on with the state dial and where we're at status-wise. We'll give a little update on 5-star. Mostly Corinne will probably give most of that, but I'll give you at least the metrics that were shared with us earlier this week. And have plenty of time for your questions, and hopefully I do some of the answers along the way, but if not, answer those ones that we weren't able to get to or that you still have. We are currently still in yellow. We've been hovering around that yellow-blue area, potentially looking to move into blue. We've finally seen our case numbers drop down into the blue again as they did a week or so ago. And so now we are back in blue for the last several days. It's continuing to drop. Now we're at 90.8 as of today's reporting of the state. So that's good. We're seeing that trend continue to drop, which we were a little concerned that maybe it was starting to go back up. So again, that's positive. The positivity, which is the number of people who are testing for COVID and how many test positive, continues to be very low. It's a slight uptick from where it was last week. It was at 2.4%, but we've been in blue for quite some time on positivity. So this is a good and stable metric, and we still are doing a significant amount of testing. This is actually 10, so I changed it when I went on there today. So we're up to 10 days of stable or decreasing hospitalizations. This again metric has fluctuated quite a bit, but has been fairly stable in yellow, and no concerns of our hospitals being overwhelmed at this point. No lack of staffing or hospital beds. So this is since a year ago, we've been tracking where we've been at on cases. You can see the significant outbreaks and spikes that we've had, but we've been on this slow, steady downtrend for quite some time now. And so that has, again, continues to be positive. And we expect that will hopefully continue. The milestones we need to make it through are St. Patrick's Day, and then certainly spring breaks. So we really are concerned about activity and travel related to spring breaks and certainly St. Patty's Day, although we have a significant weather event that's going to hopefully curb things this weekend. This is a slight change from where it was last week, a little bit uptick in Boulder cases and a little down representation from Longmont, but still very representative of where we've been for quite some time. And obviously Boulder and Longmont are the majority of our county population, so they are the majority of the cases we've seen. 112 cases in Boulder, 122 in Longmont, 49 for Lafayette, Louisville, and Superior. And then unincorporated county and our other municipalities was 47 cases. So overall, still that sort of pretty stable where we've been for quite some time. And this, unfortunately, still seeing disparities within the Latinx and Hispanic residents relative to how much population they are and versus how many cases. I think it was 75% of the cases have a known race or ethnicity. So we don't certainly know all for all cases that are reported, but for those that we have reported, we are again seeing those disparities. I think in the last week, almost 22% of our cases were among the Hispanic Latinx community. And that obviously is not related to what the actual population is. So this is most recent data I have for where we're at vaccination wise. We have a total of at least between one or a full course of vaccine. We have over 70,000 residents vaccinated. So that is good. And we continue to move through the phases. We are over 87% of our 70 plus population. So that again has been a significant milestone, and I'll report kind of rough estimates for state, but we did meet that statewide metric for 5-star businesses a week ago, and those were all notified. So if you hadn't heard that already, those businesses that have qualified and been certified at 5-star can and have been operating in the blue dial phase. So that continues to be an incentive for those businesses. That 60 to 69%, we're closing in on 50%, about 49%. So that continue to work through that phase. And then at the end of this month, we'll likely be moving into some of the other phases. So again, that 70% was hit last week. Here's again a metro tracking for those folks that work across the metro area, what that's looking like, but continue to work on making sure we get all of those folks vaccinated. But that is again good news for all those 5-star businesses. We have been really tracking where things are at, where we're seeing low vaccination rates. And now again, with that next demographic that we're looking at, 60 plus, where do we see some areas that we need to focus on in the Boulder and Longmont areas? So those are again, where we're going to be targeting doing specific vaccination clinics and outreach efforts to try to bolster our numbers. So this is a link, I'll show it again later on with a hotline number, but this is where you can get a lot more information for the state vaccine phasing. I shared this last week. I want to just do it again in case we have some new folks, and since this will be recorded, I'll go through it a little quicker than I did last week, but if you have questions, we can come back to this, but want to at least let you know where things are at with vaccine, because I know that's been the predominant focus of a lot of questions. So 1B3 is the group that is now, that phase is actively underway. That includes agricultural workers, grocery workers, Coloradans 60 years and older, and then Coloradans that are between 16 and 59 with 2 or more comorbidities. And this too small font to read, you can get all of that on that Colorado COVID site, but this lists the different conditions that would help trigger that. And those folks will work with their healthcare providers to obviously establish their eligibility and get those vaccines. This is a fairly large group within the state. It's just under 1 million people across the whole state. So this will be a challenging phase to get through, especially with the state timeline to move to the phase 1B4, which is an even bigger group, starting around the end of the month. So who's in 1B4? That's probably some of the folks that have joined this call. Not specifically saying that you're older than 50, but there are a lot of business groups, but it does include everyone 50 and older. Those higher education faculty and staff that are student facing, frontline essential workers in the food and restaurant services business, frontline essential workers in manufacturing, frontline essential workers in the postal service, frontline essential workers in public transit, frontline essential workers in public health, in human services, faith leaders, frontline essential direct care providers for Coloradans experiencing homelessness, frontline essential journalists, continuity of local government, continuity of operations for state government, adults who received placebo during the COVID-19 vaccine trial, and then people 16 to 49 with one of the following high-risk conditions kind of referenced back on that site, and similar to what was established for the 2 comorbidities in 1B3. So that's a whole lot of folks, and that's about 2.5 million estimated statewide. So this is a huge, huge group, and I know it does not include all business sectors. So unfortunately, it is very specific. It is not a county by county decision. This is a state phasing decision. So we do not have flexibility to move people that are not in these categories up. But, and Corinne has said this many times, It is important to share all this with your business, with all your staff, because they might fit into one of the categories 1B3 or 1B4 based on their age and other risk factors. So you may have many staff that may meet one of the categories, even though the business sector as a whole has not been triggered. So again, timeline, we've started 1B3, that started last Friday, and 1B4 is estimated to start at the end of the month. We are hoping to see vaccine supplies dramatically increase, which is very needed to get through all these phases. And then hoping into April that we're really seeing widespread availability for more general community. Again, this is the state website. Important to go there because this is going to be your location to get information, as well as this phone number where you can call with specific questions. All right, let's get into the dial. There was an updated amendment to dial 2.0. And so what that talks about is counties may exceed the incidence metric. This is kind of on how things are moved. So you can sort of fluctuate if you've already moved, there gives a sort of de minimis amount that you can sort of see incidence rates increase for 5 days without having to completely move out of that dial status. So again, there wasn't a lot of clarity on when you move and when you move back. This is giving a little more clarity. So hopefully once we qualify for blue, because we have kind of popped back and forth across that blue and yellow dial status, that if we do get into blue, we won't instantly move back just because we cross back over. So it gives us a little buffer there. Incidence rates calculations. This was some other clarification on what is excluded from that. So specifically looking at residents in congregate care, that data is excluded from those rates. Spectator distances, I know we've had a lot of this. We spent so much time trying to get clarification. Here's what's now in the order, that when the performers are masked, the audience can be 12 feet away, spectators. If they are unmasked performers, the spectators and audience must be 25 feet away. And that also includes to other performers would need to be 25 feet away. And spectators still always need to be masked. Restaurants, this is super confusing, and Corinne has spent the better part of a week answering these questions, but it did allow, and not just restaurants, but it talked about increases for businesses that are 5-star. While you're in yellow, you're allowed to be in blue, plus there's some additions. So what it says is that you can actually add additional folks. But for restaurants, there was also a change for last call, pretty significant change. So now, since we are in blue for 5-star and yellow for others, you're looking at either 1 a.m. or 2 a.m., depending on if you're 5-star or if you're not. So pretty big jump there. And then again, looking at those capacities, it's 50% or up to 225 people for indoors, and then 50% up to 150 people for yellow for those that are not 5-star. What is not super clear, but I'll kind of jump into the next one, is it allowed for an additional 50 people in excess of what the capacities were. So again, that's what I've added in there for that 225. But it does not change the distance for social distancing, meaning restaurants can't move all their tables right next to each other and pack as many tables as they can in there. You still have to be 6 feet between dining parties that are not from those separate tables. So that is probably still going to be the limiting factor across almost all of our restaurants. This is really probably only going to address significantly large venues that can still fit all their tables 6 feet apart when people are seated, and now go above that possible 50% occupancy or the limits that they were under. So again, this may not still clarify, and we'll go back through with questions, but that 6 feet of social distancing is still required across all the various sectors, and that's most important, I guess, probably to restaurants, because that does not allow you to decrease the distance for your tables. Corinne, anything else you want to add? I know you fielded a lot of questions around that, but maybe we can head off a few right now while we're talking about this space.
No, I just think there was a lot of confusion around the social distancing calculator and the elimination of that. And it was really meant for the really large facilities, and you covered it. We don't have a lot of those in Boulder County. And by eliminating that, it didn't eliminate the 6-foot distancing between tables. And so that's why I sent out the clarification email yesterday. So there's still 6 feet. This is also the case with, equipment. This is still the case with office desks. This is still the case. There is no elimination of the social distancing in the order anywhere. So I just wanted to clarify that yesterday, and you've clarified that here.
Mentioned this already, but again, those 5-star businesses get an additional 50 people. This was in the orders, then it was taken out, and now it's back in. So I know that's been confusing to folks, but again, another incentive for the 5-star businesses is not only do they get to be in blue, but they add an additional 50 to the capacity that they were allowed. So some businesses, this may still be a significant benefit. Others might still have some limiting factors that they won't get to fully recognize that benefit. It did allow for removal of face coverings for things, probably not for folks on this call, but for schools, people in band playing instruments, obviously that's difficult to play an instrument while you have a face covering on, depending on the instrument. So those that, would be wind instruments, now they are allowed to remove that to play. Personal social gatherings and protect our neighbor are changed. Again, we're not at protect our neighbor, but those are some changes that were forecasted. 5-star, I'll give you the metrics that were shared and let Corinne fill in any additional stuff. But as of yesterday, we had 58 audits and 51 certified businesses, predominantly in Boulder. Corinne, any other things you want to share about 5-star?
Nope, except for there is the clarification that this is open to any business type. Since we're on it, I'll add that it is about an indoor facility. We do have the question out there as to whether or not this is about outdoor facilities. We're still working on whether or not we can create an outdoor checklist. Please hold steady on that one. Also, all complaints concerning 5-star businesses do go through the state site. Just please note that we do investigate those complaints. They don't automatically lead to a warning. We do investigate. We have a team that investigate those complaints and make sure that they are 5-star complaints, and then we run them through the process. May lead to a reinspection, may lead to other pieces. I put into the chat the 5-star site that lists all the businesses that are 5-star certified, and you'll see it's everything from gyms to manufacturing facilities. Some places are doing this for PR reasons and not for increased capacities. And then our gyms are seeing a really large increase in their capacities being able to operate at blue. Going from 50 to 175 for our really large facilities is a big deal. When you have a 30,000 square foot facility, that is a big deal to be able to operate at a higher level. So please send me any questions you have. Look at the site. If you're looking for, I'm not a restaurant, what's the checklist for that? On the site is the general checklist. There are specific called out items for restaurants, for indoor events, for personal services. But if you're any other type of business, you just use the general checklist items. So we do have on here, for example, a church. You would just use the general items, and maybe if you do events, you'd use the indoor events items as well. So please look at the checklists that are on the website for that.
And I do have information from the state. They are finalizing the documents and checklists for events and outdoor settings. So that should be forthcoming. So those types of folks would be then eligible to apply and use those tools to get certified and then increase their capacities as well. So that should be coming very soon. Exposure notification system, still want to keep plugging that as a additional tool to aid public health in quickly identifying exposures so that folks don't continue to spread COVID, and you can really help us end this effort. Our schedule is remaining steady. We are forecasting, I don't know, is it next week or in 2 weeks, we're looking to potentially cancel this Thursday session, 2 weeks.
Yep, week of spring break. So we'll probably cancel week of spring break, which is in 2 weeks. And then we'll probably bring it back the week after that, which will be around the time of a potential, updates. There will probably be some updates around that time.
Yeah, and we're forecasting, again, once we see that next dial change, we probably will have a second session on Friday to really jump into that, since that'll likely be pretty significant. We also have our Spanish language session, which is recorded and should be shared today for those that will be a useful tool. So we really encourage you to look at that. And all of these recordings are shared on the Boulder Chamber site. So you can go back and see any of our recordings. With that, that's our contact information for our business team in the call center, and we can jump into questions.
All right, let's start with vaccination questions. What type of documentation would essential employees, for example, in manufacturing, need to prove eligibility in the upcoming phase 1B4?
I've asked that very specific question and have not gotten a very specific answer yet. So I don't know that is defined. I am not sure how that's going to work. I don't know what providers are going to want. So even thinking proactively, if a business wants to, on its letterhead, indicate, the name of the employee and that they are an essential frontline worker within the sector, that may be enough, but we don't have full clarification. But I think that would probably help in the event that providers are going to need something, which I assume they will. And I'm not sure how that's going to work as far as coordination, because public health won't be able to work with every business to set you up with a provider. So it will likely be getting people connected to various providers that are already listed on our website. So that would be what I would encourage right now. In the absence of us getting any information, to me, that seems like a logical place to start, along then with people bringing some kind of photo ID that shows that they are the person who's listed in the letterhead.
And for the restaurants, for example, they're looking at setting up pods throughout the state, 6 pods, to help serve that group, because there's going to be a lot within that group. And under that specific question, we have a question that's, is there a definition for a frontline restaurant or food worker?
There's no further other than what's on that state website. So that would be the only resource that's out there. So that's the only other thing to go to, is that coloradocovid.org site that I shared. That's the only resource that we have out there. I would say in the restaurant cases where pods are organized, it will likely be incumbent on the restaurants to produce the rosters so that they can figure out, as they do those pods, how many people per restaurant are they forecasting. And it's really important that people make the slots, because it's very difficult when people miss their window to get vaccinated, to try to get people back in. So it's really important, short of them not meeting the eligibility because they're ill at the time of vaccine, that people really make sure they make it. And the vaccines do need to be used. They don't have a shelf life once they're out there at a clinic. They have to be used within 6 hours.
Okay. When do you feel that we'll be at 50% of Boulder County residents vaccinated? You show there were about 25% now, and subsequently 75% being vaccinated.
Yeah, that's the crystal ball type question of, it's all dependent on how much vaccine we receive. So, we're at 25% and we started vaccines, in January. So we're, a little over 2 months into our vaccine efforts and have made it to 25%. So if our vaccine supply doesn't increase, we have another 2.5 months to go. If we see big jumps in supply, it'll happen faster than that. So yeah, it's all relative to supply. We have the capacity to do a lot more than what's happening right now. So we can get more vaccines out. And as Corinne said, when more supplies start flowing, there will be other large pods to try to serve various groups and underserved populations too. So it's still hard to project. Hopefully within the next couple months would be a rough estimate.
And we have our third vaccine now, and I know that the state of Colorado got it for 1 week, then a couple weeks we're not getting Johnson & Johnson, and then we'll get Johnson & Johnson again at higher capacities. Yeah. So hopefully that'll increase it, and then we won't have any more weather disruptions to vaccines coming in and other extenuating circumstances that delay the delivery of vaccines to our state.
And I think that's just an important piece, is given the unknown amount of supply of the various vaccines we're going to get, if you get a chance to get vaccinated, do not be discriminatory and say, well, I only want this type of vaccine because of whatever reason. You should take whatever vaccine is available as soon as it's available. If people are waiting for a certain vaccine, you might miss your window, and that's going to really, I think, challenge us to get all the populations vaccinated. And again, people may miss out completely on their opportunity until it's just general population. So when you're in the various sectors that are getting vaccinated, take whatever vaccine is available. They're all have high efficacy. Johnson & Johnson is a single dose and has a lower efficacy. The others are a two dose and have a higher efficacy. So again, there's benefits on either side. So take whatever you can get.
And you mentioned something that I've been telling as many businesses as I can, which is push out the vaccine information to your employees, whether or not you're in the categories, because you don't know if they have 2 or more comorbidities, or how old they are, or whether or not they need to see their doctor because of situations, and they may qualify, and you may end up getting some of your employees vaccinated before you've even hit that timeline. All right, some more vaccine questions. And somebody reminded me I haven't gotten to their question, what I'm doing right now. Someone says, I hate to keep asking this question, but given the rates for the Latino population have gotten better, is there anything new planned to address this disparity?
Well, I showed some of the GIS maps and the mapping that we're doing. We're looking at that for various populations as well. So we are trying to target efforts, clinics. There's also been town halls, Spanish town halls, to work with the groups. We have cultural brokers. There's a whole host of folks that are working specifically on the disparity issue outside of our team. We are doing our Spanish sessions, but that's not the focus for the vaccine. There's a whole group that's targeting that specifically. And so there will be more targeted vaccination clinic efforts, as well as continued outreach efforts across the county. So,
including some mobile clinics going into neighborhoods that, instead of asking individuals to come to the clinics, going into the neighborhoods and some of the zip codes that are underrepresented, using some of the cultural broker networks that are available. But you've also hired some additional staffing to address some of the disparities, and filled those positions recently, which is a great step forward in addressing some of these disparities. Yeah. And I should have said the thing should say haven't. The question should have been haven't. All right. If you do grocery shopping and delivery, for example, like an Instacart, do you qualify as a grocery worker? Or should you call under that?
Meaning that they're doing the shopping to fill those orders? Yeah, I would say you do. You're actively in that grocery store filling those orders.
Okay. And a lot of the grocery stores are using their in-house clinics to do the vaccinations, unless they don't have them, and then they're using additional resources to do the vaccinations. All right, let's see how many. Wondering about daily symptom checks. Do you think those are still needed once a certain percentage of staff are vaccinated? If not, what percentage?
Yeah, and until that goes away, that's still an important screening tool. That has always been one of the ways that people have identified ill employees and avoided potential outbreaks within their business. So it's still very important for people to be diligent about that. Honestly, there's still a large percentage, I think like 50% of cases can still be asymptomatic. So people may not, you can still potentially have sick people showing up that won't even get triggered by a screening. So you absolutely need to catch the ones where you do have some of those symptoms popping up. So it is still important. We're still concerned about, the evolution of the virus and the various strains. We do have a South African strain in Colorado. So those are other big factors that we need to be looking at even people who've been vaccinated. It's still not going to be 100% effective vaccine, even with everybody vaccinated. So,
and even the latest CDC recommendations around vaccination, it was very limited situations that allowed any changes. I mean,
yeah,
I
we're going to still be a ways from stopping a lot of those really important tools. So it's we know that there's going to be a subset that won't get vaccinated. There's going to be a subset that can't get vaccinated. That's a pretty small group that really can't, but the amount that won't, that's what we're trying to really minimize, that because people who can and choose not to are putting the rest of the community at risk.
So I have a little anecdotal story. I was out, and there was a group of individuals who were like, "Oh, don't worry, everybody, we're vaccinated." And I was thinking to myself, well, that protects you, but you could still be a carrier, and that didn't really protect me. So I just wanted to make sure that it's clear that like you could still be a carrier. Like there's no proof yet that please keep your mask on. Please realize, let's keep our distance, because that's great that you got vaccinated, but I want to still protect myself because I'm unvaccinated. I still want to protect myself just in case you're a carrier. My husband's a teacher. He's vaccinated. I still want to protect. We still want to protect ourselves. All right. I think I got through the vaccination questions. If you have more, we'll get to those. Now we have some other questions. Can you do drop-in basketball for youth and adults? And I think there's a clarification question. At a recreation center, for example, could you have two families while wearing masks come in and play, can play pickup basketball against each other?
They need to wear masks, and that's some of the complaints we've been fielding are people whose masks are around their necks. So that obviously is not protective of anyone. But the gatherings is still at 2 households, 10 or less people. So as long as it's meeting those requirements, that's the limitation.
But
right?
you couldn't do 10 people from 10 different households in a pickup game.
You can't just open gym for anyone that wants to drop in.
Okay, so that would be any of those pickup games. It would have to be limited to the 2 households wearing masks.
Yes.
Okay. What do you do if your facility does not have a capacity metric assigned, so you don't know your capacity metric or your capacity?
There's no listed fire safety.
That's what I'm assuming that she means.
Yeah, I'd be surprised any approved space that has gotten its CO from the local municipality should have had some of those pieces. So that would be the first place, I guess, to potentially check is in with the city, and if there was a fire marshal inspection, that sort of stuff, they should have verified that you met all the things you need to of sprinklers and fire alarms and all that sort of stuff, and what the capacity is for safely occupying that space. If you don't have any of that, you can use the space calculator. It's probably going to be a lot more restrictive, but that will at least tell you how many people can safely be in there and move about. So that would be the most restrictive minimum. But again, under the dial allowances, it's typically more than that. So that would be the only other sort of guide I could give you is here's what the most restrictive limiter would be, that space calculator.
Okay. So then there's a 5-star question. If we have multiple offerings under one roof, can we certify one but not the other as in 5-star? For example, we're co-working by day and events by night and weekend. You're certifying the facility. So for example, in this case, you're going to be certifying the facility, and you wouldn't really certify one or the other. The only example that would be a difference is if, for example, you're a distillery in one part, but you're a tasting room in another, and you just want to do the tasting room, you can do that. But this is all one facility, so you'd certify the facility and how you operate it. So it's one checklist.
And I would just say, Corinne's exactly right, but in effect, maybe you are. So if you're only worried about the events, you're still likely certifying the other side of your business, just that wasn't your intent. But as you go through and look at all the requirements, it will then ultimately trigger things for your other function at the same time. But if
in this case, your spaces are all going to be common. So you're going to need to make sure that your bathrooms and if you have elevators and all those, you're going to end up, certifying all of those and make sure you have the signage for both, because it's all one space. So, unless it's two separate spaces. So, you're going to just look at the checklist, go to the website, look at the checklist, see if you can, meet the requirements of the checklist. And if you can, just, apply for the 5-star and we'll work through it with you. Sorry if you hear a little whining in the background. I have a new puppy and he's a little whiny. Any other questions out there? I have a question via email, actually. Let's say you're kind of like a fitness studio, dance studio, yoga studio, and you have you're an employee or something, and your child has a stomach ache. Can you still work that day, not knowing if your child has COVID, or can you still come in and work that day?
Yes. Yeah, it's not a screening for symptoms of people, again, people that are positive for COVID, that changes it to them. If they're a high risk exposure, then they do need to quarantine. But somebody who's just has a symptom, is not diagnosed with COVID, especially one that's nondescript, that could be a lot of different things, that doesn't mean somebody who's been around them now has to quarantine or be excluded from work.
Now, let's say you're an instructor and your partner has a outstanding COVID test. Should you wait until they have the results of that COVID test and they're ill?
Yes.
But you have no symptoms. Should you wait till you get the results of that COVID test?
Yeah. Any probable cases, that's where we would want people to start to quarantine until those tests come back to refute that it is COVID. Even then, obviously, if it's a major respiratory disease, those people themselves should already be excluded because they are sick with something that's probably contagious. So it is important that people just do that in general. It's why we have such problems every year with flu and many other diseases, is people don't take these precautions that we put in place for COVID. They work for all of those respiratory diseases. So
I think there's just a lot of confusion out there. It's just that you're let's say my child is sick, but I'm not, and I have him out with an outstanding COVID test and he's sick. So what do I have to stop doing? So, and I think there's just a lot of questions on there, and how what I should stop doing, what my employer should not let me do. There's just not a lot of guidance on that.
If it is suspected that it's COVID, that's where you should get a test done to confirm what the disease is. And if it really is something that think it could be COVID, then you should start to take extra precautions. So it's not an intent that, well, as long as we don't get tested for COVID, we don't ever have to do anything. That's obviously how we've had tons of disease spread, because people just say, well, we aren't going to get tested, then we don't have to do anything. And then we'll just stay in the same problems we've been in for a year. So that's why it keeps spreading, is people don't take these things and actually do them. So,
but if you're sick, don't go out, don't go to work, whether it's COVID or not. If you're throwing up, don't go to dance class today. Whether it's COVID or, it's not one of the major symptoms. So probably if you're better in the next day or two, you could probably go back because it's not one of the major symptoms. But don't go to dance class, don't go to yoga class, kind of thing. It's something that our society tend to push through. And I think this coronavirus is teaching us that we shouldn't push through, that we should not go out when we're sick.
Yeah.
I think the person who emailed me some of these questions is sending me a thank you. Any other questions out there? All right. Oh, somebody wants a new puppy picture. He just left the room. He's really adorable. He really is. I will get you a new puppy picture if he comes back in. Any other questions out there?
Looks like one popped in.
All right, I'll let everybody see my new puppy while we're on.
Oh,
Here we
boy.
go. Say hi. All right. Last question. What are your thoughts on herd immunity?
It's very important for us to get there, and it's going to take everybody that can get vaccinated to get vaccinated, and especially when your slots or phases are triggered. Again, the hope is we can get everyone vaccinated and get herd immunity and get rid of the virus before it continues to mutate beyond what the vaccines are effective for. So that's the other real important reason why people need to do it. I think there's a thought, some people are like, well, if other people do it, then I won't have to. And again, it only works if we get to a really high percentage of our community. And again, we have pretty amazing vaccines to be 95% effective, and that still means 5% won't be effective. So.
Just confirming, even having taken a vaccine, a person can still carry COVID to others.
Yes, that is possible. It's likely that people will not get sick. If they got sick when they're vaccinated, it would likely be very mild. But again, they potentially could have the virus to give to others that are unvaccinated. And that's the big concern with, again, the various strains that are out there. Even when you're vaccinated, you could potentially, thinking that now you can travel, you can go acquire other strains and then bring them back. First of all, you could still possibly get sick, but you definitely could give that to others that are not vaccinated.
If you read about the efficacy, the efficacy is around not severe illness and hospitalizations. And so we just want to make sure that people are not dying or getting hospitalized from this virus. Yes, vaccinated, but you could still be a carrier. In some cases, you can still get sick from the virus. That's why they're not 100%. Any other questions out there? All right, we're approaching 1:45. Thank you for letting my puppy make his appearance. All right, we will see everybody next week. As a reminder, we will skip the week of spring break. And then if there are any updates, just like we have done the last couple of weeks, if there's any updates to the order, any clarifications, if I'm getting a lot of the same questions, I will send out clarification emails, but do not hesitate to ask those questions, because if you have that question, there's a good chance somebody else has it as well. All right. Thank you, Lane. Have a wonderful rest of your week.
Thank you.